Hello, everyone. This episode focuses on cervical cancer and Cervical Cancer Awareness Month. It is dubbed Cervical Cancer, Decoding the Big C with Amref Health Africa's new strategy. Joining us will be our special guests, Dr. Chris Barasa, who is an obstetrician, gynecologist, and chief of party at Amref Health Africa in Kenya, and Dr. Benjamin Odongo Elly, Gynaecological Oncologist and acting CEO of Kenya's Obstetrical and Gynaecological Society of Kenya, KOGS. So, before we get into the podcast, please tell us about yourself, Dr. Barasa. So, do you have any surprising talents or hobbies that most people don't know about?
I'll ask my senior to start. Medicine's like military.
So do you have any hobbies or hidden talents that you can share with us today, just so that we can break the ice?
Yeah, thank you for having me here.
Mm-hmm.
Maybe one of the talents, I wouldn't really call it a talent, is the ability to adapt. Mm-hmm. To situations like when Dr. Barasa asked me to come to this podcast, I really didn't know what to expect.
Fair enough.
Yeah, so I am here to see whether we can share the knowledge and also both the clinical and the public health aspects, so that we can be able to address this the disease that's affecting our women.
Okay. And what about you, Dr. Chris? Any hobbies?
I play badminton.
Oh, cool. Really?
I'm
Yeah?
not so sure you knew that.
Okay.
Yeah.
Okay.
And lawn tennis. Those are my hobbies.
Okay. That's
Yeah.
great.
And I do cycling actually every day.
Yeah?
Yes.
That's good. You're very
I
healthy.
just did it today in the morning. I usually do my 15 kilometers every day. Yeah.
And then the last question I have for you guys is, who has been your major inspiration professionally or personally in your lives?
Maybe I go first again. I wouldn't really say one particular person, but it's quite a number of individuals that I've read about and I've admired their achievements. I'll give an example of Malcolm X. Having come from a background that was not really promising, and he rose to the point of being a major player in the struggle for the civil rights of the black people. I keep remembering one of his speeches called the ballot or the bullet, another one called by any means necessary, which really inspired the movement towards desegregation.
And you, Dr. Barasa?
And Elly talks about those serious people. I'm left to wonder what I'll say, but but to me, I think my source of inspiration has been my dad. Just looking at the way he does things and the way he has allowed me early enough to take charge of my life, and that has really motivated me to move up to where I am. The second person I would say the late Dr. Robert Aisi, unfortunately passed on last year, or no, 2 years ago because of Corona. But he actually saved my life. I was 5 years old because I had a lot of bouts of malaria several times. There's a time when I went in and one of the nurses, I think, made a mistake. We call it medical mistakes. Sometimes they happen. I get an injection and then things go wrong. But he was just around the corner and he came in and actually he saved my life because I had actually gone into what we call anaphylactic shock. So that was really a source of inspiration, and I told myself I must become a doctor to save lives. That's why I'm here.
That's amazing. And as we understand saving lives and cervical cancer in Kenya, what's the current state of cervical cancer in Kenya, and why is it a significant health concern?
Yeah, the cervical cancer, first it's good to define what the cervix is so that we know what we are addressing, because cervix can also mean neck.
Yeah,
yeah, the neck literally. But in this case we are talking about the lowermost part of the uterus, It is tiny part of the uterus, and part of it is inside the vagina, and that's why it's exposed to some of these agents that cause cervical cancer. So having really defined what the cervix is, we should also know it is invisible. So we have really to examine for you to see where the cervix is. So the situation is that we have a number of women being diagnosed with cervical cancer. I may first give the global picture is that we have more than 500,000 cases each year, and we track down to our country. The latest statistics that is recorded was around 5,300, but I know it could be more per year, and out of which half of that number is what is reported as mortality arising from cancer of the cervix. Another bit is that most of it is diagnosed late. They come to us when they are maybe above stage 2 and above, because by that time they start having the symptoms. Notably, we are seeing cervical cancer in women who are in the less privileged population, in that they are the low income earners. They come from neighborhoods that are not really affluent. And then in addition to that, there are women who have got many more children. We call this grand multiparity, women with many more children. So this is the kind of picture that we are seeing of the women who come under our care with cervical cancer.
And how does cervical cancer typically develop, and what are the common warning signs of cervical cancer?
Yeah, the development of cervical cancer, to address this, we must look at the risk factors associated with it. We now know that there's a direct association, cause and effect relationship between human papilloma virus and development of cancer of the cervix. I don't want to go into the details of genetic changes and the pathology or how it happens, but for the general population, we should know that infection with human papilloma virus, more so if it occurs when a woman is still much younger, then that puts them on the path towards development of cervical cancer. The issue is not usually the infection, because we know that the prevalence of HPV in East Africa actually is around 30%, as compared to other parts of the world, which is around 11%. So we have quite a significant prevalence of HPV. So even one single sexual exposure can put someone at a risk of getting the infection. The problem is usually persistence. Many women clear the disease. By the time they are 30, then they have cleared the disease. But there are factors that lead to persistence. One of them could be there are very high risk types that persist longer, or there are other core factors in the host. These include maybe they're immunosuppressed, but in this case the commonest being HIV, whereby we know that the persistence is the risk is 4 to 5 times more than the women who have got good immunity. And the low immunity could not just be due to HIV. We also have women on organ transplant, cancer treatment, and all that. And also other core factors include smoking, multiple sexual partners. Of course, this, we know it increases the more variants of infection. And co-infection with other sexually transmitted infections. Because we now know that there could be a relationship between co-infection with other sexually transmitted infections like chlamydia, amongst others. Of course, there are other associations that have been described. I may not mention them now, the use of contraceptives, which we may not really delve into, because there's postulation that there could be some relationship with that.
Okay. And Dr. Chris, in terms of cervical cancer, can you explain the concept of people-centered healthcare systems and how it relates to the prevention, treatment, and combating of cervical cancer?
Thanks, Halima. There's a lot of dynamism in as far as the approach, programmatic approach to managing these conditions, or health-related conditions for that matter. And there's a paradigm shift rather, from a clinician perspective. So gone are the days when the doctor knew everything and the patient was on the receiving end, and they were informed on what they're supposed to do. Now there's a paradigm shift for us to think through what if we came from a patient's perspective and be responsive to their needs, and then we'd be able to strike a balance between what really the patient requires, and what from a technical point of view as doctors can be able to provide us solutions to. So a patient or a people-centered approach basically talks to a health system where as doctors, as healthcare providers, we go to the other end of the coin, or the table for that matter, and be a bit more responsive to the needs of the people. The solutions we provide have to come from the people, and it boils on several aspects. One is just looking at making information available so that people can be able to really know what are some of the disease conditions that may affect them, contextualizing some of the disease conditions that we have. For instance, I'll give you an example. We, as a country, we need to be aware that certain parts of Kenya, there are more prevalent conditions compared to other parts of Kenya. Dr. talked about HIV and cervical cancer. So we wouldn't be surprised that cervical cancer will be more common in areas that have higher rates of HIV, as an example. So if you come up with an intervention that's blanket, that says we are going to manage cervical cancer across the whole country without considering some of those factors, then you may not be as responsive. There are some parts of the country that have more cardiovascular diseases, as an example. So we want to customize interventions that fit those particular populations, and then engage the population to come up with solutions that are more relevant. You've heard of stories where you come up with an intervention, you bring it to the population and they don't use it. Okay? You've heard of situations where people actually build hospitals, very huge hospitals with a lot of millions of shillings gone into it, but no one uses it. Why? Because it wasn't responsive to the people or the needs of the population that we are serving. The other aspect is basically looking at how can we be able to have more access to the services that we are providing. And access in this case, it's usually physical access, so making these a bit more accessible. And you're looking at having primary healthcare interventions that brings services closer to the people for them to be able to access them. And the second access point usually that we talk about is financial access, so the cost of the services, so that we can be able to come up with interventions that can be able to support people a bit more. And then the last aspect that I want to talk about is just being able to be adaptable to the changing dynamics of the diseases and the way they present themselves or manifest themselves, as it were. When I was in medical school a few years ago, we used to read and say cervical cancer affects women above 60 years. The practice is different now. So you might find even, I think, Doc, the youngest patient probably could be...
We have had 18 years, we've had 20 years.
Exactly. Yeah. So as young as 18 years, 20 years is also getting cervical cancer. So if you are not adaptive to this change in the disease presentation, then you may come up with interventions thinking the cervical cancer only affects above 60. Then you leave out this very critical population without interventions, as it were. So by and large, those are the three aspects that I can talk to when I'm talking about people-centered healthcare. Yeah.
Okay. And how does Amref's new strategy address the challenges of cervical cancer in Kenya?
So our new strategy focuses on women and young people. And that's actually our mission. And I'm glad actually the partnership you're having with KOGS, because KOGS also, that's their mandate actually. The KOGS mandate is basically to take care of the interests of women and their health needs. So we are looking at how can we provide solutions to this population through primary healthcare interventions. Actually, that's our primary goal as it is. And cervical cancer becomes critical to us, of course, because it affects women, okay? And then at the same time, if you look at the disease progression, it starts from an early stage when people are still a bit younger. So by the time you're getting cervical cancer, maybe at 40, the process started about 15 years earlier, okay? So the thought process being, we need to now focus a bit more on young women, okay, and probably adolescent girls, so that you can put in preventive measures to prevent the development of what we call fulminant cancer of the cervix, 15 years or 10 years later, as it is. So Amref strategy is to focus on these population groups by providing them with approaches that can be able to prevent the progression of these diseases as it is. And cervical cancer is a critical component of our strategy because in our population, actually it affects a lot of women. And quite a number of women have died of cervical cancer. The disease has progressed over time, and they haven't known that actually the disease is progressing over time. So if we can put in place some interventions early enough, then you can avoid some deaths that may occur later on in life.
And in terms of strategies and partnerships, can you provide an overview of the partnership between KOGS and Amref and specific goals related to maternal and neonatal health?
Okay. So I'll mention a few of them, and then I'll ask the acting CEO to also just mention what we've been able to do. So by and large, as Amref, we envision as a situation where every woman and every young person in this country will be able to have access to equitable health care. So, and you can't do this alone, okay? You can't do this alone. So we've purposed this year to really reach out and partner with like-minded entities to be able to work together. And some of the things that we are looking at, broadly speaking, and the question we're asking ourselves is, for instance, why are women still dying of preventable causes in the 21st century? Okay, and one of the preventable causes of death in women is cervical cancer. Unfortunately, yeah, it's usually very painful if a woman comes. Doctor will tell you a woman comes to you with stage 4 cervical cancer. You know very well at the back of your mind this took 15 years to reach where we are. And unfortunately, they may have gone through the health system and we have missed it out at different stages. By the time they reach the gynecologist here, it's a bit too late in the day. So we're looking at how can we partner with other organizations for us to put together resources and thoughts that can be able to tackle this at a broader perspective. We've started with KOGS because, as I mentioned, our mission is more or less very similar with KOGS. But our bigger picture is to actually enshrine this at the Ministry of Health level, at the CS level, at the DG's level, and be able to really encourage other partners to join this fight. And a critical thing that we want to look at is actually maternal mortalities, broadly speaking. So just being able to identify what are the commonest causes of maternal mortalities. Postpartum hemorrhage is an example. It's a critical thing. Infections, cervical cancer or cancers for that matter, and not just necessarily cervical cancer. So that once we have that kind of database that gives us what are the commonest causes of maternal mortalities, then we come up with strategies, the roadmap towards ending maternal mortalities in Kenya. And we are looking at achieving this SDG 3.1 that talks about reducing maternal mortalities to less than 70 per 100,000 in this country. Where we are right now, we're above 350. Okay, different data sources give us different measures. So moving from where we are at 350, I'll take that as the benchmark, to 70 the next 7 years. It's a tall order, but we believe with partnerships with the likes of KOGS and other like-minded partners, we can actually be able to achieve that and change forever and the picture that we have in as far as maternal mortalities in this country is concerned. I just want to mention, Halima, that for the last 7 years, we've only moved 7 by a figure of 7. If we continue like that for the next, if we continue at this rate, then it will take us 100 years before we achieve the SDG 3.1. And therefore, we must actually proactively be involved in the process so that you can be able to achieve this and probably save a few lives of our mothers. Yeah. But I want Dr. Elly to just chime in also from that partnership perspective so that you can be able to see how we're working together as a team. Yes.
Yeah, thank you. We, as KOGS, we are really happy to work with Amref in this partnership in ending preventable maternal mortality, really preventable deaths. And it's going beyond just the mothers, also looking at the children.
Yeah.
I usually look at it in 3 key areas because this collaboration also involves training. How do we improve our skills? We also have issues with the research. What is killing women? How can we address them? And of course, service delivery also. Notably is that we can save women from postpartum hemorrhage, but they end up dying from cervical cancer. And that's where now this partnership comes in to just not only create awareness, but also map up strategies, or rather really strengthen strategies that can end preventable deaths from cervical cancer.
And Cervical Cancer Awareness Month is significant to the context of maternal health. So how does cervical cancer impact maternal and neonatal health, and what preventative measures are being emphasized in this?
My senior can take that.
Yeah, maybe I'll start with the last bit because we have to prevent it. How it impacts maternal health, it is so obvious because once a woman dies from cervical cancer, more or less than not, the family breaks up. Many times the women are the backbone of the society, in that the children will miss a mother, the men will miss their wives, will lose their wives, and so it becomes a broken kind of family. And that is why we have to prevent cervical cancer. WHO has put in a kind of a call for elimination of cervical cancer using a strategy which is the acronym is 90-70-90 strategy, which we have adopted as a country, and I'm sure Amref is very strong in this particular 90-70-90 strategy, which I may speak on for a very long time, but let me just summarize it. It just means that 90% of women at least should have primary prevention with vaccination by 15 years. I know this is a subject that is a little bit controversial. And then the 70 is that we should have a high performance test to screen these women. You know, we started this journey more than a decade ago, whereby we were screening women using a single visit approach. You use acetic acid to see whether there are any changes on the cervix. But now we know that we have a high performance test, which in this case is HPV DNA screening, just to check, does the woman have the high risk type that causes cervical cancer. But we don't stop at screening. It's unethical to have a screening program with no intervention. So out of the women who are screen positive or who have premalignant condition, premalignant means the disease takes a long time before it develops into obvious cancer. Even those who have diagnosed with cancer, 90% of them should receive care and an intervention. And the interventions are many. It ranges from just excision procedures, which means you remove the part that is affected by the disease, or to radical procedures, including radiation and palliative care, depending on the stage that you get them at.
And how does community involvement and education play a role in these strategies? Yeah.
Maybe I may go first, and then
Yeah.
Dr. Barasa will pick it up. Yeah, prevention of cervical cancer, it is multi-pronged. We already know the risk factors, and some of these can be addressed by public health education or even forums. For example, we know that early sexual debut will predispose them to cervical cancer. So is it possible to keep our children longer in school? Like I said, there's no really magic bullet that is only the doctors who can do this. This is multi-sectoral, from our religious leaders, Ministry of Education, gender matters, to ensure we keep our girls longer in school. Then there are also issues to do with avoiding the other core factors. We have got abstinence, Be Faithful campaigns, amongst others. Maybe just to mention a bit about vaccination, because the countries that have eliminated cervical cancer, I'll give an example like Australia. They have very robust vaccination programs, which vaccinate not only girls but also boys. We also have countries like North America, in Canada, which are on their way towards elimination. They have also very robust vaccination programs.
Yes, and thanks, Doc, for that. I'll approach it from just to add on to what Dr. Ari has mentioned. If you look at a screening program, for instance, and compare the cost of a treatment program for cervical cancer, the difference is significant. Because it may just cost maybe around an average of 2,000, 3,000 to do a screening, say a pap smear or VIA or whatever method you are going to use. You look at the cost holistically, vis-a-vis treatment of cervical cancer, which may go into hundreds of thousands. Okay, and what I usually say is that 15 years down the line, okay, the cost of treating cervical cancer definitely will go much higher. So if you do a screen today, you save dollars of shillings, or rather dollars or shillings, Kenya shillings in future. So and that's why we emphasize on screening, because we're actually managing a scenario that could be more expensive. And there's a concept we call catastrophic health expenditure. What that means is basically that we are as poor as just one disease condition. Yeah, to eat a family. So you just need one person in the family to go down cervical cancer, and it may wipe out all the resources that family has ever had, as it were, because of the costs. And the cost not just in the treatment, but if you are a lady and you are in the productive age groups and you are going to work, and now you start developing cervical cancer, it means you can't go to work because there's a smell that you start producing. So you not be comfortable going to work. So chances are you lose your job. When you start getting your treatment, it means you will spend a lot of time in hospital, so you'll not go to work. So the productivity at work becomes a problem. So if we are the person that the family has been depending on, then it means the revenue of that family is completely cut out. So the future of that family definitely becomes bleak, for that matter. The second cost is psychological cost to it, because we are still stigmatized. If the mention of cancer in the society, everyone starts saying, oh, that one has cancer, that one has cancer. So the mental health aspects of it become very costly to that family, to that woman, to that husband, to the children, for that matter. It's a cost that most of us don't think about, but just diagnosis of cancer is on its own psychologically very expensive, for that matter. So we want to talk about aspects of how can we prevent this so that we don't develop cancer, as it were. I know the government has come up with quite a number of measures, and as Amref, we've been really supporting some of these initiatives to be able to really see how can we have universal health coverage, and how can some of the insurance schemes like NHIF be able to cover most of this, including screening for cervical cancer and even treatment for cervical cancer. The second thing is how can we have equipment that the government can provide to even far-reaching places. Halima will tell you that if you need to have radiotherapy for cervical cancer, it's one of the treatment modalities. If you come from Bungoma, where I come from, you have to come all the way to Nairobi for you to be treated for radiotherapy. And even Nairobi, I think we only have like how many machines now, Doc? Are they 4 or 5?
Yeah, right now actually there has been an expansion towards availability of radiation.
Yeah.
In the western region,
yes,
we now have more teaching and referral.
Now it has.
Good. Radiation.
Mm.
It's been there not for very long.
For very long. Okay.
Yeah, at the coast also. In Nairobi, we have several facilities that are offering radiation.
Mm-hmm.
But like you say, the cost of treating is quite exorbitant because we are looking at not just the psychological bit, but the financial bit. Treating cervical cancer through radiation, you require at least 2 months to go through the whole process, because you are looking at 25 fractions of external beam radiation. And then after that, you have to do what we call brachytherapy or intracavitary treatment.
Yeah.
So it's a long time. But that's why I think we should really emphasize on preventing cervical cancer.
And with Amref's focus on empowering women and young people, are there specific initiatives underway to educate and involve young people in cervical cancer prevention?
Certainly, yes. There are quite some programs that, as Amref, we've involved ourselves in, and aimed at basically supporting young people. There are projects that we run across the country, actually in most counties, in relation to just sensitizing young people, both in school and out of school. Because again, as long as a lady is sexually active, then they are likely to get cervical cancer. So in our reproductive health messaging, we've been able to have specific projects that run that. Critically, again, is just engaging in the education sector as thought leaders in that, and the school health programs. We've actually involved ourselves in that, because policies surrounding, HPV vaccination. The doc mentioned that there's a bit of hesitancy, and it's a big problem. Yeah, it's a big problem. So we've involved ourselves in some projects that aimed at actually sensitizing parents and guardians on HPV vaccinations. And there's a time actually personally I was involved in such an intervention in Turkana, the farthest part of this country, where we're actually sensitizing. We go out of the way, go to the schools, we go to hospitals, we go even to households to be able to sensitize. Once you've done mapping and there's a lady here who could be the right age for vaccination, then we actually go out of our way to be able to do that. So there are quite a number of community interventions that we do, school-based projects that we do, including even universities, so that we can be able to just sensitize them on how to handle productive health aspects, including menstrual hygiene, including STIs and other infections that may predispose them to developing cervical cancer, and just being able to be nurtured into responsible adults.
And are there specific programs or initiatives that are focused primarily on supporting women in last mile communities that Amref is involved in?
Yes, certainly. Also, we've done that quite a lot. Last mile meaning that we want to deliver services closer to the people. We've had projects in Samburu, we've had projects in Turkana, we've had projects in Homa Bay, partnering with several initiatives. We've had projects that deal with, for instance, fistula management and care, projects that deal with FGM, okay, care and management, Kisi, Nyamira, Kajiado here. And when the Kwale now, we have a project there. And we have projects that are specifically looking at primary healthcare interventions, just supporting the national government to be able to bring services closer to the people through development of primary care networks. Because a primary care network basically is aimed at providing that solution, providing services closer to the people, engaging the communities, sensitizing them, putting up multidisciplinary teams, and just ensuring that actually services that are layered, so that we have community interventions, level 2, level 3, level 4, and have a very clear referral mechanisms. And even outreaches. Amref has supported so many outreaches in this country in as far as just ensuring that places like Turkana, where the closest, some of the distances from households to the facility is about 30 kilometers. So you want to have an interface so that you can bring the services close to the people through outreaches. And there's a model we call Kimormo that I don't want to go into today in detail. But just looks at how can you be able to bring services closer to the people, including animal health, human health, plant health, close to the people so that they can be able to access the services much faster.
And then when we're looking at primary care networks, one of the things that's really important is looking at incorporating data in digital transformation processes. So how does Amref's strategic plan leverage digital transformation to improve cervical cancer awareness, especially in last mile communities?
So one of the things that we've done deliberately, and as Amref, is to support the Ministry of Health to develop what we call an observatory. An observatory has 3 components. One, it gives us data on the most prevalent conditions across the different primary care networks in the country. As I mentioned earlier, I would at a click of a button know that cervical cancer is more prevalent in this part of the country, esophageal cancer is more prevalent in this part of the country, or this particular disease condition is more prevalent in this part of the country. So data driven. Okay. The second aspect of that is for us to be able to know how is the functionality of the systems that you are putting up, the PCNs that you are putting up. So we are going further to just be able to really identify. For you to say that a primary care network is functional, what are the parameters that you need to put in place? How do you measure? How do you assess the functionality of a PCN? The third one that's also very data driven in the observatory is what are the potential outcomes and what's the potential impact of setting this up? So there are quite a number of disease conditions, including cervical cancer, as it were, that you are able to really make a projection and say, if things remain the way they are, this PCN is likely to give us this number of patients developing cervical cancer. And that's how programs develop. We say, can we now look for money and prevent this? Because if we don't do anything about it, this is where we shall be. But if we do something about it right now, we'll be able to make an intervention that will stop the progression of this. And as I said earlier, cervical cancer, cancer of the cervix, a perfect disease. Okay? In epidemiology, talk about it's a perfect example of a disease that can have a very, very good prevention program, because it takes time for it to develop, as opposed to others like, let's say, malaria, okay, whose incubation period is a bit shorter, for that matter. Cervical cancer is a perfect, because it takes a lot of time for it to develop into fulminant cancer, cancer of the cervix. So you can actually plan and come up with interventions using data that can be able to manage this 20 years down the line, and you'd be as close to hitting your target or impact, as close with a lot of precision compared to other disease conditions that we have. Yeah.
That's fair. And Dr. Eli, I have a question. So, how do healthcare policies in Kenya impact the fight against cancer?
Yeah, we have a very healthy policy environment. By this I mean we have a very good policy direction, especially guided by the National Cancer Control Program. And actually, if you just look through that website, they are very beautiful policy documents. In addition, we have guidelines, which have been developed by support with partners like Amref, and also KOGS, and other partners giving now technical input. It's not enough to have the policy documents. Now we have to reach a place whereby we lobby for resources to follow the implementation of the policies. This is has been well explained by Dr. Barasa here about what they are doing even to the last mile. That needs resources to do that. Having said that, it's good just to also mention probably the risk of going back about the vaccine hesitancy. The government of Kenya rolled out a vaccination program as part of the prevention strategy for cervical cancer, especially for young girls. But there has been a lot of resistance to vaccine uptake. The concerns have been addressed, though the consensus has not been reached, and probably the concerns has been to do with fertility issues, that what is in the vaccine may predispose to formation of antibodies against pregnancies. There has been concerns about the content of aluminium. Others include OTC, but we know that the trials have shown that the vaccines are safe. It just needs more engagement with those who are having concerns about the vaccine to see that we can have address the issue of uptake of the HPV vaccine.
And Dr. Chris, you talked about SDG 3.1, but how does Amref's new strategy align with global health policies, like the Sustainable Development Goals in the fight against cervical cancer in Kenya?
Yeah, so I just mentioned that because that's where we are focusing a lot more. But by and large, Amref is in support of quite a number of SDGs along the health-related SDG 3. So 3.1 talks about maternal mortalities, 3.2 talks about neonatal mortalities, neonatal deaths. So for this partnership we're having with KOGS, actually, we are focusing a lot more on the 3.1 and 3.2. But others, like malaria, cervical cancer control, actually, climate change, we're still aligning ourselves to the climate change interventions, as an example, which are still part of the water and sanitation, just still part of this SDGs that you're looking at by 2030, and also just aligning ourselves with the country's Vision 2030 priorities that we have. So Amref still has positioned itself as a thought leader in most of this, and we're actually sitting on most of the national and international bodies that are discussing this. I think just last month, that was in December or around that time, we saw us actively actually participating in the Global Climate Change Convention, just to mention but a few of some of the things that we are doing, because we believe that if we don't participate in providing solutions to the health in Africa, then our understanding or our role in this paradigm shift will not be achieved. So we really we must work with international organizations, local organizations, for us to be able to really define the future of healthcare in Africa as Amref.
What are Amref Health Africa's future goals in the fight against cervical cancer?
But if we come specifically to cervical cancer, we align with what Dr. Elly talked about, the 90-70-90 vision or mission by 2030. So Amref's vision is to support that alignment so that you can have proper vaccine uptake, proper screening, and proper treatment services or access to treatment services. So working closely with KOGS, the National Cancer Control Board, and other like-minded partners for us to be able to achieve this objective. Yeah.
Okay, thank you so much. Do any of you have any final thoughts or comments on cervical cancer awareness and Cervical Cancer Awareness Month?
Dr. Elly.
Yeah, we must put ourselves in the shoes of the women who are really the bearers, they bear the brunt of this disease, and look at the effect that this condition has on their families, and that will cause us to think seriously about preventing it. It will not be done by one organization or one person. This is a kind of a multifaceted engagement, right from under the leadership of the Ministry of Health, the National Cancer Control Program, and we plug into that national strategy for cancer prevention.
Dr. Chris?
I think Doc has summed it up very well.
Okay.
Just support what he says, that we cannot do it as an individual organization. It calls for a multi-partner engagement and having these discussions, not just wait for January when you have cervical cancer awareness, but really have a robust plan that runs through the whole year, so that every day becomes an awareness day, and probably be able to also just track the milestones that we've been able to achieve. Sometimes I feel like we don't do very well in terms of data, so we don't really track what we have been able to achieve over time. So it will just be a clarion call that we partner better, track the milestones, and be able to achieve the 90-70-90 targets that we all have.
Okay. And thank you so much, Dr. Chris, and thank you so much, Dr. Elly, for your invaluable insight and shedding light on the critical role of people-centered health systems in our fight against cervical cancer. It is clear through community involvement, education, accessible healthcare, we can make significant strides in cervical cancer awareness and prevention. This approach will not only save lives, but it will also empower communities with the knowledge and tools that they need to take charge of their health. To our listeners, thank you so much for joining us on this important discussion on cervical cancer. It's been your host, Halima, and if you have any questions, queries, or concerns, please join the conversation and contact us on our social media platforms, which are Twitter at Amref_Kenya, Facebook at AmrefKE, and Instagram, which is #AmrefKenya. And thank you so much for listening. We appreciate your feedback and engagement. Stay informed, stay healthy, and see you next time. Bye.